Moments ago, the World Health Organization declared monkeypox a public health emergency of international concern. The declaration means the monkeypox outbreak is an extraordinary event that could spread to even more countries and that it requires a coordinated global response. Joining me now is Dr. Uche Blackstock, MSNBC medical contributor and founder and CEO of Advancing Health Equity. Dr. Blackstock, what does this declaration of monkeypox as a global emergency mean for us?
Good morning, Charles. Thank you so much for having me. So this is very important, and this is the declaration that we were waiting for. So as you mentioned, it essentially says we are prioritizing this emergency, and what we need is collaboration of all global communities, of all countries, to ensure that resources, one, are spread out equitably. As we know, monkeypox originated in Central and Western Africa. And we know that there has been, significant disparities in terms of vaccine and therapeutics dealing with monkeypox. And so what this declaration will ensure is that countries will share their vaccine and therapeutic supplies. They will also make sure that they have consistent messaging about the public health issues surrounding monkeypox. This also, it's a recommendation and it's not a mandate. So we need that all of the WHO global partners to follow this declaration, profoundly.
Do you expect the U.S. to follow suit and declare monkeypox a public health emergency here?
You know what? They really should consider it. And the reason why is because the way that monkeypox is behaving now, it's very different than it's behaved before. It's spreading very rapidly. Even some of the symptoms are different. The rash appears differently. We've really seen an increase in cases significantly over the last few weeks. And so for that reason, and because the public still doesn't know that much about monkeypox, and because we have people being affected day by day, it probably would be in the best interest of our communities to make them more aware, and that would be in declaring an emergency here in the United States.
As you may know already, the LGBTQ community in America is loudly condemning the American response to this. They are most heavily affected in the early days of this outbreak of monkeypox. Do you believe that the American government is doing enough, particularly for these LGBTQ people who are suffering right now from this disease?
Right. Yes, so I would say no, not enough. And I know a lot of, especially people who are experts in the HIV community, would also agree. It's been very slow in terms of the vaccine rollout, very slow in terms of informing people about the availability of therapeutics. We already are one step ahead of where we were with COVID in that we have a vaccine for this and we have therapeutics for this. But the fact is that the public health messaging has been quite poor. Even the coordination has been quite poor. I think what this points to is that, one, we haven't learned from COVID. We haven't learned from the HIV epidemic. And we have the LGBTQ community really being the most impacted right now, and we can do better.